blighted ovum is a type of miscarriage that occurs in the first trimester of pregnancy. It's a pregnancy that's developing without the embryo. The term anembryonic pregnancy can be used synonymously with the term blighted ovum. So this video is all about blighted ovums or anembryonic pregnancies, how they happen, how they're diagnosed, and what the management options entail. In a typically developing pregnancy, the embryo can usually be visualized on ultrasound at just 6 or 6.5 weeks. When a patient goes in for their very first prenatal ultrasound, their provider will use the ultrasound to confirm that the pregnancy is developing at the expected rate based on the patient's last menstrual period or the date of conception. With a blighted ovum, the gestational sac, the sac surrounding the pregnancy, forms, but the embryo does not develop inside of it. This results in an empty sac that is easily visualized on ultrasound. Check out my other YouTube video where I discuss the most common cause of blighted ovums and how our age affects our chance to experience a miscarriage and our chance for a blighted ovum. I'll link that video here and in the description down below. I'm Katie Lee, CGC, a certified multi-state licensed genetic counselor, and I've personally experienced 5 pregnancy losses, including 2 blighted ovums. In today's video, I'll talk a little bit about my experience with blighted ovum, but mostly what I'll focus on are the signs of blighted ovum, how they're diagnosed, and what the management options might be. If you're watching this video because you or your loved one just got a diagnosis of a blighted ovum, I am so sorry. I have also sat at my OB's office with the ultrasound tech, waiting to see that little gummy bear on the ultrasound, and so excited only to find out that my pregnancy wasn't developing typically. With both of my blighted ovum pregnancies, I experienced all of the symptoms. I was extremely nauseous, I had breast tenderness, fatigue, and that led me to believe that everything was going well. So both times, especially the first, I was completely caught off guard to learn that my pregnancy wasn't developing as it should be. And I really struggled to know what questions to ask my provider, especially because I wasn't expecting to get that news. And then even after I got that news during my follow-up appointments, I was just really sad and wasn't sure what to ask. So if you're not sure what questions you might want to ask your provider or what route you might want to take with treatment, please consider visiting my website, katieleecgc.com, and downloading my blighted ovum care guide. You can find this linked in the description down below. To talk a little bit about my experience, when I had my first blighted ovum, I was not aware of any friends or family members who'd been through the same thing. I found so much consolation just reading stories other people posted on Reddit or on websites, going through what it was like to get their diagnosis of their blighted ovum, how long it took for their HCG levels to go down, what treatment option they chose, whether they chose to take medication or just wait for the miscarriage to happen naturally, or what their D&C was like. It was so helpful to hear all of those stories, especially in a great level of detail, to help me know just what to expect, because there was so little information that my own OBGYN had shared with me when I got my diagnosis that I just had no idea what it would be like. And a big reason that I started my YouTube channel was to share my expertise as a genetic counselor who works in assisted reproductive technology and preconception, but also to share my own story. And that's brought, honestly, a lot of comfort to me to share my story and to know that it might help even one other person who's going through the same thing I've gone through. So what I'm hoping to do is gather 100 stories of people who've experienced blighted ovums so that an individual can look through and find other people who are going through what they are and know what to anticipate and hear kind of all the different perspectives of what it was like for them. If you would like to share your story of your blighted ovum, please find the Google form in my description and share it. And I'm going to plan to post a series of all of these stories on my website at katieleecgc.com, and then also to make another video to pull out some of the commonalities and themes in the future. So how would somebody know if they're experiencing a blighted ovum or an anembryonic pregnancy? Unfortunately, there's really no way to know until you get to your ultrasound, and there's just no way to predict it. So for many people, they are having a routine, typical early first trimester of pregnancy, and it's not until their ultrasound where the ultrasound tech notices that there is a gestational sac but no embryo forming, that they are clued into the fact that they might be having an anembryonic pregnancy or a blighted ovum. Of course, it's possible that some people who experience an anembryonic pregnancy could have bleeding or cramping. They could even miscarry at home and not know that their pregnancy was a blighted ovum. But for the vast majority of people, the people I assume who are watching this video who went into their OB's office and got that ultrasound that only showed the sac, usually there's no warning signs. There's no lead up to the fact that you're having a blighted ovum. There's no way you could have known. And that brings us to the next question. How are anembryonic pregnancies diagnosed? Again, they're pretty much always diagnosed in the first ultrasound, the first prenatal ultrasound. If the ultrasound reveals an empty gestational sac, that is probably an indication that you could have an anembryonic pregnancy. However, importantly, the lack of a visible embryo could also be due to incorrect dating. So if a patient, a pregnant person, is not sure of the date of their last menstrual period, for example, it's possible that their pregnancy dating could be incorrect, and the individual just might be much earlier in pregnancy, maybe 2 weeks earlier than they assumed. And if this is the case, then the pregnancy might simply just need a week or two more to keep developing and for that embryo to be visible on ultrasound. So depending on your situation, how far along you are in your pregnancy, it's pretty common that a provider might ask you to come back for a follow-up ultrasound in a week or two to confirm whether the embryo has started to develop or whether the sac is still empty, which would confirm a blighted ovum. Let's talk about management of blighted ovums. There are 3 options that are typically offered as management for a blighted ovum, and you should absolutely talk to your doctor about these different options, what options are available to you, and to best understand the risks and benefits for each of these options. Typically, if there aren't any medical complications that require a surgical procedure to remove the tissue from the uterus, then the patient's preferences are usually taken into account. So let's talk about these 3 options: expectant management, medical management, and surgical treatment. Expectant management is the term to describe waiting for the miscarriage to just happen on its own, without any intervention, without any medication or treatment or procedure. If you go this route, your provider may ask you to follow up with an ultrasound in the future or HCG testing to confirm that the miscarriage is complete and that there isn't tissue remaining in your uterus. This method essentially is the wait and see. Wait to see if the miscarriage tissue passes on its own. And if it doesn't, you may ultimately need a higher intervention. The second option is medical management. This involves taking a medication called misoprostol vaginally and or orally, depending on your preference and your doctor's recommendation. The medication should start the process of passing the tissue. Again, your provider may likely recommend a repeat ultrasound or HCG testing to confirm that the miscarriage is complete and that no tissue remains in the uterus. Unfortunately, there is also a chance that this medical management option does not work and the tissue remains and that you may need surgery to get the rest of the tissue out of your uterus. Which brings us to option 3 for treatment. That's the surgical treatment. So a surgical procedure can certainly be used to evacuate or to empty the uterus, and there are various ways that this procedure can be performed. Sometimes it can be offered just in your clinic with local anesthesia, and other times it's performed as an outpatient surgery in an operating room with sedation. During the procedure, the doctor simply removes the tissue from the pregnancy, and oftentimes surgical evacuation results in just a faster and more predictable, complete evacuation of that tissue. Over the course of my 5 miscarriages, unfortunately, I have tried all of these options multiple times. When I had my first miscarriage, I was really set on wanting to just have a natural pregnancy loss. I had never been under anesthesia. I was really scared of it, and I just thought my body would pass the tissue on its own. Unfortunately, that didn't happen, so I moved up to using the medication, the medical management approach, and that didn't work for me either. And by that time, I'd been going back and forth to the OB for lots of appointments and ultrasounds and blood draws for like 3.5 weeks. And finally, I had the surgical procedure, and it was just a really long, painful, sad, awful road and experience having to go into the OBGYN's office that many times. And just being really fearful of the surgical procedure. So I have a lot of thoughts. On these different options, and I think it is a very, very personal choice. It depends on how you weigh the pros and the cons of each of the options, but I do now see what I had often read when I was trying to determine what I wanted to do, which is that the benefit of the surgical procedure is just that you get it done quickly and there's no back and forth waiting to see if the tissue passes, and that can be a huge relief. Just to know that the tissue is very likely going to be all removed at once, and there probably will be no major follow-up, which is a relief if you are sick of going to the doctor and dealing with a loss. If you're interested in hearing more about my experience with expectant management, medical management, and surgical treatment as treatment for miscarriages, early first trimester miscarriages, let me know. I'd be happy to make a video on it. And most importantly for you, if you're trying to decide your next steps, talk to your doctor about the pros and cons and what your concerns are and fears are. I just didn't do this. I was in shock, and at my follow-up appointments just so upset and trying to get out the door and away from my OBGYN that I did not ask the questions I should have. So I created a guide, a care guide on blighted ovums that contains a nice list of questions you might want to ask your doctor. Things that you might want to ask, like how might one treatment option versus another impact when I can conceive again? So a list of questions that I've formulated based on my own experience that could help guide potentially what you and your doctor decide is the best follow-up for your blighted ovum. And you can find my digital downloads on my website at katieleecgc.com. One other nice resource would be checking out this bulletin by ACOG, the American College of Obstetrics and Gynecology, on early pregnancy loss, because this bulletin walks through the pros and cons and some of the research that's been done on each of these different forms of management. Before I wrap it up, I want to talk about one important question that a lot of people have after experiencing a miscarriage or a blighted ovum, which is, what is the prognosis for a future pregnancy? I think the mantra that I told myself, and something important to know, is that most people who experience a miscarriage will go on to conceive again, and most people will go on to have a successful pregnancy in the future. Your doctor knows your pregnancy history and your medical history best. You deserve personalized information about you. That includes details that your doctor would know from your fertility evaluation, from the age of your egg source and sperm source, the health of your egg source and sperm source, and so forth. Importantly, if you've already experienced multiple miscarriages, you should probably be asking more questions. I would say you probably should consider seeing a reproductive endocrinologist. That's a doctor with additional training and expertise in pregnancy and getting pregnant and staying pregnant. Now, regardless of what's next for you and what option you decide to utilize for treatment or for management of your blighted ovum, just know that it can take months, it can take more than months, it can take a year or years to emotionally recover from blighted ovums and pregnancy loss. I had to take nearly a whole year off of trying to conceive despite desperately wanting to have a second child after my first miscarriage, after my blighted ovum, my first one. It can just be devastating, and it can be really, really hard for others to understand your pain and the pain of this loss of this family member that you so wanted, this pregnancy and baby that you so desperately wanted. So just know that in our community, others who've experienced these losses, they feel your pain. You are not alone. Your feelings are valid, and even if others who haven't been through it can understand them, it is completely valid and normal to feel devastated and upset about a pregnancy loss if that's what you're feeling. You might consider reaching out to others for support, maybe joining a Facebook group comprised of other people who've gone through pregnancy loss or blighted ovums, or ultimately seeing a therapist. That was the most helpful thing that I did, besides reading the stories of other people who've gone through pregnancy loss. If this video was helpful for you, please like, subscribe, and check out my digital downloads. Take care, guys. Hang in there.